Hello, and thank you for joining us for the 49th Annual AAKP National Patient Meeting. We hope you have been enjoying the sessions. My name is David Rodriguez, and I am a proud kidney and liver transplant recipient from the state of Texas, and a former dialysis patient. I have had the honor of serving on the National Board of Directors of the American Association of Kidney Patients and as an AAKP Ambassador since 2017. These roles have given me the invaluable opportunity to advocate for patients like myself, ensuring that their voices are heard and their needs are met. My professional background as a former patient relations specialist at the University Transplant Institute in San Antonio, Texas, has significantly shaped my approach to patient advocacy through strategic planning in vulnerable areas and my experiences visiting dialysis treatment centers throughout my career. I have been deeply involved in public speaking to a broader Spanish-speaking audience and in networking and building relationships with healthcare professionals. These experiences have enabled me to better understand the complexities of healthcare and advocate effectively for policies that improve patient care and outcomes. Through my work with AAKP, I am committed to making a positive impact on the lives of those affected by kidney disease, and I'm dedicated to using my experiences to help others navigate their own journeys. As a proud member of AAKP, I firmly believe that every kidney patient's voice is paramount in determining their care plan. It is essential that we cultivate an environment that encourages kidney disease research and innovations, driving continuous advancements in care, improved treatments, and solutions for unmet patient needs. Once these innovations receive FDA approval, it is equally important that all patients have access to and the right to choose the best treatment for them in consultation with their chosen healthcare team. This ensures every patient can live their best life and achieve their aspirations. With that, it is my honor to introduce our next session titled Disease Management, Medication Management, Incorporating the Pharmacist as Part of the Care Team. AAKP recognizes the importance of comprehensive medication management as a vital component of disease management. Incorporating pharmacists into the care team not only enhances patient safety, but also empowers patients to take an active role in their treatment. These sessions will explore the critical role that pharmacists play in optimizing medication management for kidney patients, ensuring that treatment is both effective and safe. Today's speaker is a good friend and an ally partner of AAKP's, Dr. Wendy St. Peter. Dr. St. Peter is a professor at the College of Pharmacy, University of Minnesota. She is a recognized leader in the field of nephrology pharmacy, with a deep commitment to advancing the roles of pharmacists in managing the complex medication regimens required by kidney patients. Her research and practice have greatly influenced how pharmacists contribute the multidisciplinary care team. Dr. St. Peter leads the Advancing Kidney Health for Optimal Medication Management research project, which engages pharmacists and key stakeholders to develop partnerships for optimal medication management in persons with kidney disease to improve healthcare outcomes and reduce healthcare costs. AAKP is proud to be a partner in this project since its inception and 100% support the critical role pharmacists play within the healthcare team. It is my pleasure to turn it over to Dr. St. Peter.
Thank you, David, and thank you, AAKP, for the honor of presenting at the 49th AAKP Patient Conference. I'd like to acknowledge AAKP and also my co-presenter, Rebecca Maxson. I'm going to be talking about the privilege of caring for patients with kidney disease from a pharmacist's perspective. But I think almost more importantly, I'm talking about the perspective of our initiative to engage pharmacists and other team members in the care of patients with kidney disease to have the privilege of caring for all patients with kidney disease. Our initiative has this big vision in that not just one, but every person with kidney disease receiving optimal medication management through team-based care, including a pharmacist who's educated in treating patients with kidney disease to ensure that their medications, and not only just one, not just two, but all of their medications are safe, effective, affordable, and can be used as intended. I want to give you a little timeline about our ACHOME, or Advancing Kidney Health Through Optimal Medication Management initiative. We began our initiative in March of 2020 when a number of nephrology or kidney pharmacists met together with some other experts to talk about this big presidential executive order that started to focus on kidney disease. And so we recognized that there was a big opportunity with new value-based care models that the Centers for Medicare and Medicaid Management was rolling out to get pharmacists into the care team to work with patients with chronic kidney disease. So I just want to give kudos to the American Association of Kidney Patients. They were one of our first stakeholders in our initiatives. They recognized right off the bat that this initiative to put pharmacists into care teams for persons with kidney disease was going to be an effective strategy to optimize medication management to prevent progression of kidney disease. So by December 2020, after I was able to do a sabbatical, which means I had a whole semester off from teaching at the university, to network with all kinds of people, all kinds of organizations like the American Association of Kidney Patients, we established several work groups, which I'll be talking about later, and we engaged a multitude of stakeholders, not only just AAKP, but Hemodialyzers United. We had lots of pharmacy organizations, the Renal Physicians Association that was adamant that they needed pharmacist help in the clinics. And we got everybody together and started working towards some of our goals. In June of 2022, we got to the point where we had enough information mass to publish standards for pharmacy practice in the area of chronic kidney disease. We had not had those standards. Our colleagues in Canada had those standards, but we hadn't here in the US. So we published those, and along with those, almost side by side, we published the education standards to educate pharmacists and pharmacy students to be able to do what they needed to do to provide that medication management with patients with chronic kidney disease. By 2023, of April 2023 to be specific, we had started rolling out our curriculum, our interprofessional curriculum for pharmacists, physicians, and nurses on the area of chronic kidney disease. And I'll be talking about how effective and how many modules we are able to create in the time frame we've had since then. And then in July 2024, our second big piece of our initiative, so curriculum was really the first. The next one was our Learning and Action Collaborative, and that was really to focus in on helping practices, nephrology practices and primary care, put and implement a pharmacist into that practice to provide medication management. So how can pharmacists help patients? Well, in a multitude of ways, but really our primary goal is working with you to optimize your medications. Again, all of your medications, not just your kidney-related medications. To do that, though, takes an interdisciplinary team. So when I was working at Hennepin County Hospital, I was working in a unit specifically for chronic kidney disease patients, and I worked with a really effective interdisciplinary team. Had a nephrologist, dietitian, social worker, nurses practitioners. I had a lot of student learners, resident learners, and so this whole team worked together to provide the best care for patients with kidney disease. How do pharmacists work with patients? They do this to help start patients on medications to slow chronic kidney disease progression and reduce risk not only for that progression, but also for prevention or progression of heart disease. And we're in such an exciting time because 5 years ago, we literally had one type of class, the sartans or the prils, so things like losartan, enalapril, lisinopril, to treat hypertension as well as to reduce CKD progression. Today, we have 4 drug classes. So we have the sartans and the prils, but we also have the flozins. We have empagliflozin, which you might know as Giardians from the commercials, or dapagliflozin, which is Farxiga, for helping reduce kidney disease progression, as well as finerenone, also known as Kerendia, and semaglutide or Ozempic, that can also help reduce kidney disease progression. So it's a really exciting time in the area of kidney disease. What else do pharmacists do? Well, they help prescribe. That is something that is necessary in people that happen to have a lot of different medications, to stop those unneeded medications. And some of the reasons we do this is, that patients tend to have lots of medications because they have lots of doctors, like a heart doctor, a kidney doctor, a diabetes doctor, and they all are prescribing different medications. But sometimes what happens is the patients have a side effect for the medication, and then a doctor prescribes another medication to treat the side effect instead of changing the medication to something where the patient doesn't have that side effect. We also have situations that I think many of you can relate to, that you have a condition that has been treated, like, for instance, gastroesophageal reflux disease, and a proton pump is prescribed to treat that condition, and then it never gets deprescribed or taken off of your medication regimen. So I want to share with you a really great video that was created by Dr. Marissa Battistella based on some of the research she did in Canada. She is a kidney pharmacist, and she's going to talk to you a little bit about what deprescribing is and share some really important patient perspectives.
People on hemodialysis take on average 12 medications per day. Taking a lot of medications is known as polypharmacy, and it can have negative effects on your health. For instance, people might experience side effects from taking too many medications, or they may forget to take their medications, or they may even forget why they were prescribed in the first place.
Many patients on dialysis require a long list of medications, and keeping track and understanding why they're taking those medicines and adhering to that prescription are often challenges.
Over the years, for different reasons, medications have been added to my regime. My family doctor, nephrologists, and other specialists have contributed to certain medications I'm taking. And sometimes you forget, why was that medication added?
At the beginning, it was hard, just because I never took so much medicine all the time, and I had to get used to it. I have a blister pack, so I take it in the morning, but it's coming back from dialysis. I'm tired, sometimes I just want to flop in bed and go to sleep. So then I mess up my timing when I want to take my pills.
Medication management is about ensuring you are taking your medications correctly and that you know what each medication is for. The goal is to keep you feeling your best. You might be hearing about a term that's used when talking about your medications called deprescribing. Deprescribing is part of medication management. It is when your healthcare team, including your doctor, nurse practitioner, and pharmacist, assists you in lowering the dose or stopping a medicine that may no longer be helping or may be causing harm.
I had gout 10 years ago, but I was still taking the medication to prevent it. And that's, just in case. But the uric acid wasn't high, and it was a pretty good one to remove. There was another couple of medications related to prostate conditions, and there was some duplication. They were prescribed for the right reason at the right time, but now there was one that could be removed. When you're taking 13, 14 medications, removing one, that's tremendous.
Medication management requires open, clear, and ongoing communication between you and your healthcare team. It's important for healthcare providers to encourage you to talk about your medications by asking you questions. You should always share how you're feeling and any problems you might be having with your healthcare team.
Our patients are on a lot of medications, and then it comes down to, are they taking the medications, the side effects? Because sometimes patients don't tell you if you don't ask.
I'm pretty active in understanding what my medications are supposed to do. And sometimes when, let's say, I'm not feeling right as a result of a medication, I'll vocalize it and a different medication will be suggested or whatever. It took a number of years to get the right cocktail of blood pressure medications. So I had to share how I was feeling, the dizziness, standing up, and we just chose different medications. And now I've been super stable over, a number of years.
It's important that your healthcare team spends time with you to explain your medications and how to manage them. And they should answer any questions that you might have.
When you agree that a patient agree that they'll take the medication, I think it's nice to sit them down and tell them what to expect. Let them even have an idea of the side effects and give them time to think it over and not force it on them. And sometimes you're more confident to take it when they explain things to you properly.
It's also important for your healthcare team to check in with you to see how your medications are working.
If they would just come back to you and say, listen, I'm going to assess things, let you know how you're doing, and then make a decision to discontinue or reduce the amount of medication. I really think that that's so important. We as patients, we want to know what's going on. And no one wants to be on medication for the rest of their lives if they don't have to.
Taking and managing medications is a big part of being on hemodialysis. Some medications are necessary and must be taken, but sometimes there are options. The goal of medication management and deprescribing is to ensure patients are taking only the medications they need to take. It's very important that people always talk to their doctor or pharmacist before changing or stopping any of their medications.
I just want to thank Dr. Estella for doing that video. But I wanted to make the point that although the people in this particular video were patients on dialysis, that everything that was said in the video on the patient perspectives applied to those with chronic kidney disease before dialysis. And in fact, the whole idea behind excellent and optimal medication management is to catch the disease early and prevent or at least slow it down from progressing so somebody reaches end-stage kidney disease where they need dialysis. So that's what it's all about, starting further upstream and making sure that you understand your medications. We can help you access those medications and use those medications appropriately and why you're using them, and really educate patients such as yourselves to be empowered to ask those questions and know what questions to ask, to work with your pharmacist and work with your physicians when you get new medications, and make sure that they're working with all the old medications you may be taking. The fact is that your kidney doctor or your primary care doctor cannot do all the things that is required for good medication management, because they're ordering tests to diagnose your disease or conditions. They are trying to educate you on kidney disease. They may, if somebody's reached the point where they're at end-stage kidney disease, they're planning for kidney replacement therapy. They're trying to educate you on diet, exercise, and medications. Well, that is frankly impossible. And with physicians only having 15 to 30 minutes, for their care visits, 30 minutes is a lot nowadays, that they just don't have time to do it. So it takes a team, and it takes a team of nurses, nurse care coordinators, for example, to coordinate all the different visits, pharmacists to really coordinate that medication management, help work with patients to educate and empower them to help them self-manage their medications, dietitians to weave that really important dietary as well as, those behavioral issues that we all need to correct, better diets, more exercise, and then social workers that can help with those social things, social disparities, social aspects of getting medications and having access to medications. We all need to work together, and it really is important that we all communicate effectively, especially keeping patients in the center as that very most important part of the team. I just wanted to briefly tell you about how we operate in our Advancing Kidney Health for Optimal Medication Management initiative. You see here, we have myself as director, and we have Dr. Rebecca Maxson, who you introduced at the beginning, and Dr. Calvin Meany, who are assistant directors. Rebecca focuses on our Learning Action Collaborative, and Calvin, our curriculum. And then we work with a number of work groups underneath this whole initiative, stakeholder engagement, where it's so important to make sure that we're going in the right direction. And we have patients as well as physicians, pharmacists, and other healthcare providers on this team. We also, underneath that, have a very important patient engagement committee, which helps us create materials to share with patients and also tools that physicians can use in working with patients. So this is a very important committee, which we have a number of patients with chronic kidney disease as well as their care partners on this committee. We have a communication and media committee to get out publications, presentations, and communicating about all the good things that we're doing. Then we have our two big focus areas, our Learning and Action Collaborative with Rebecca leading that, and a curriculum and training with Calvin leading that. So a little bit more about our curriculum. I'm really proud of this. In the last year and a half, we've developed 21 different educational modules. These are created for the interprofessional teams, so pharmacists, physicians, nurses, and some of them in the future with social workers and dietitians as well. And we have different, groups of modules. We can see that in the right-hand slide, we have modules on specifically addressing those 4 categories of drugs that really are our 4 pillars of care in patients with chronic kidney disease to reduce progression of kidney disease and reduce heart-related outcomes. We also have a number of modules that go side by side, these 5 modules that talk about really important medications like blood pressure and diuretics, glucose or sugar lowering medications, and importantly, for helping pharmacists and practices have a pharmacist engage in their practice are these value-based care models and how we can use those models and some of their incentives to get that pharmacist into the care team. I'm really proud of 5 modules that we created based on research we did with Black or African American persons with kidney disease, where it really is focused in on medication-related disparities, but also solutions for working with patients with kidney disease. These Black persons with kidney disease told us what their needs were in terms of their medications and medication management, and we need to all take that very seriously in terms of designing things to work well for patients. And then we have some really important modules in terms of focused in on symptoms that patients have. So treating pain across chronic kidney disease and anxiety and depression. I think it's really a recognition that if we don't address the things that patients are most focused on, like pain, that it's unlikely that they will, take sometimes their other medications. So all these things are so important together. Patient voices are really key. It's what makes our at-home curriculum different. We have videos that tell your perspectives and stories, which really help healthcare professionals understand where you're coming from, your journey, and understand your needs in terms of them helping you through that healthcare journey. We have integrated patients as part of our research team. Dr. Glenda Roberts, as well as Curtis Warfield, our two patient advocates who have been working with us on our research. They were the ones that helped us with design and implement and really create the presentations for those modules on African Americans with chronic kidney disease. We have a curriculum committee where patients are on, so they shepherd the curriculum or all these educational modules through beginning to end. And then we have a curriculum advisory committee or panel that includes patients and provides feedback on the modules as they get developed. And these modules are online. They can be watched anywhere in the world, and it's free. And it's free for professionals. And these are things you can reach out to your physicians and your healthcare team to take so they understand more about you and more about treating chronic kidney disease with medications. So you see all these little icons or people on the screen, but the first characters on the screen indicate that committed community. So this is with our Learning and Action Collaborative that we're just initiated within the last month and a half. It helps bring together healthcare practices that want to advance patient-centered medication management in the chronic kidney disease space, and that they want a pharmacist on their team to either advance their practice or to initiate a practice in chronic kidney disease health. The Learning and Action Collaborative provides direct support to those teams for coaching. So each team has their individual coach. We give them those educational resources I just talked about to increase their knowledge and help develop their skills. And then we ask them to track their performance, how they are doing, for instance, in initiating those guideline-directed medication therapies that reduce progression of kidney disease. It's also a really important mechanism to have teams share because there's no one team that has the perfect team or the perfect medication management or healthcare management within their team, but each team has things they do well, and they have pieces of the puzzle that they can bring together to work with all the other teams to share those effective methods so each team builds their effectiveness in medication management. And then at the end of the Learning Action Collaborative, which is 16 months, they have achieved their aims or their goals. We celebrate with them, and then we disseminate this information to other teams and other practices so they can emulate what these practices have done and achieved. So just to share with you what our Learning and Action Collaborative goals are, it's really, again, to focus on including pharmacists on those healthcare teams to help coordinate and help patients manage their medications in patients that have kidney as well as heart and diabetes related conditions, and their doctors to help reduce risk of CKD progression as well as heart disease. And it's also to help meet new value-based payment models, those ones that Medicare has been advocating to help them meet their goals and provide that proof to support that coordinated comprehensive medication management. And then lastly, it's really to foster learning and action to disseminate that information to ensure best practices in patients with chronic kidney disease in the United States. We just launched our Learning and Action Collaborative, our first cohort or our first group in July. We've got 8 teams that are working with us across the U.S. It's a combination of primary care practices that want to improve that early care of persons with chronic kidney disease and really they're at the best stage to prevent that kidney disease progression. And then also nephrology teams and healthcare systems that simply want to expand pharmacists into kidney-based clinics. I also wanted to point out that we have really been working hard, and we have a theme issue coming up in the American Journal of Health System Practice that focuses specifically on the management of chronic kidney disease and really focuses on that medication management. It really is important because not only do we include insights and research from practitioners, but almost every article includes the perspective and insight of patients and their care partners, and those people are authors on the papers as well. Our expected publication for this is in early 2025. So the big message I want to end with is that we can't do it without your help. And with your help, we can do it. AAKP always needs volunteers. As you notice, we have a number of different committees and subcommittees that we need help with. One is the Patient Engagement Committee. We want patients, care partners, providers, doctors and nurses to be on this committee so we can develop patient-related tools, things like education pieces, as well as tools for those practitioners working with patients with chronic kidney disease. We also need patients on our curriculum advisory panel that help shepherd and, basically help us figure out what are the most important things to put in these educational modules for practitioners. We also need you to provide your voice through our continuing education, our publications, and in social media. So we really want you to work with us. On the next slide, you're going to find my email and Rebecca's email. So please speak with us through email. Please contact us if you'd like to work with us or just simply need more information. So I want to thank you all, again, thanking AAKP for allowing us to be here to talk with you. Please join our AAKP initiative and let's advance medication management of chronic kidney disease throughout the United States. Thank you.
That was a wonderful presentation, Dr. St. Peter. Thank you for being with us. Before I let you go, I have a few questions. How much should the pharmacist be a part of the decision-making team along with my kidney doctor and other healthcare team providers?
That is an excellent question. Within each team, the roles of each one of those practitioners may be different, but I'm just going to give you an example from our health system. It's a Fairview University health system in Minnesota, in that we have pharmacists. In fact, within that health system, we have 62 pharmacists that work in primary care clinics. So they're embedded in those clinics with their primary care practitioners. And we also have pharmacists working in the specialty clinics like a kidney clinic or cardiology or heart clinic. And what those pharmacists do is they work really closely with those practitioners. And for instance, in primary care, they can start medications, they can change medications doses, they can order labs to monitor those medications, they can order durable medical equipment like blood pressure monitoring devices as well as glucose monitoring or sugar monitoring devices. So they have very extensive responsibilities within our health system. But the key is they work very closely with those physicians, and the physicians love that because it gives them more time to work with patients to diagnose their conditions, to watch their conditions, but allows that pharmacist with the knowledge of those medications to really work with patients, educate them. They spend oftentimes an hour of time working with people like people with chronic kidney disease, so they have enough time to explain how the medications work, what questions that patient should be asking, what concerns patients have, so they make sure they get their questions answered. So again, I think we're training pharmacists now to work at the top of their license to do these things, and it's to allow those physicians and nurses to do the things they do best, let pharmacists do what they do best.
If I'm prescribed a new medication, what questions should I ask my pharmacist to understand how it might affect my kidneys or interact with my current treatment plan?
Well, of course, that is a very important question in that your pharmacist And especially I'm talking about clinical pharmacists that have the time within clinic settings to work with you. I'm going to just put the caveat that many times pharmacists working in the retail space, like Walgreens and et cetera, don't often have enough time to do that comprehensive review with you. But with new medications, you should expect any pharmacist to be able to help you with, first, what is the drug for? So if you have one understanding from your doctor and your pharmacist is talking about something else, then you should be inquiring further, why are you taking it and why is it important to take it? You should be asking about the side effects you might have. Not every single side effect in the world, but what are the most common things that might happen? And then, of course, if they do happen, then you should follow up with your pharmacist or your physician about those side effects. Also, pharmacists have special ability to, and also software and information tools that they can help determine whether you have a drug interaction or a drug food interaction with a new drug that you have, or in the case of these clinical pharmacists who have more time in the clinic to work with you, all of your drugs, to make sure that when a new drug is added, that it's safe with your other medications and it's going to be hopefully effective for you. So that's really important to understand. If you should take it at a certain time of day, you need to ask that question. Do you have to separate it from food or drinks or specific drugs? All those things are important. The thing that you have to know, however, is that your medications have to be filled in a pharmacy, all of them from the single pharmacy, so that pharmacist can see exactly what all you are being given and that you're taking, so they can make that assessment. The problem is, if you go to multiple pharmacies, which many patients do for cost-related issues, not any one pharmacist or any one doctor for that matter will know all the medications you're taking. So that's why, if it's possible and you have one of those clinical pharmacists within your clinic, it's really important to engage with those pharmacists, because you can go over your entire medication list with them and they can help you with all the different things I've just been talking about.
How can I ensure my pharmacist is fully aware of all the medications I'm taking, including over-the-counter drugs and supplements, to avoid potential drug interactions?
So this is a question that relates to the last one I talked about. So the one thing I always will tell patients is that over-the-counter medications, as well as things like herbal medications or supplements, they all have some activity or effect on the body. You should think of them all as drugs. And your pharmacist and your doctor, all of your doctors, need to know everything that you're taking. And that's really important, that you're honest with your doctor and your pharmacist about what you are taking. I know when I go into the doctor, they ask me every time, what medications are you taking? If you're not taking that one, take it off the list. If you are taking another one, like a vitamin D supplement or something you've just started, you need to add it to the list. That is the only way that everybody that's taking care of you knows what you are taking. And it is the only way that they can really ideally test for drug interactions, that drug food interaction, as well as understanding if, the drugs, you have duplicate drugs, those sorts of things, or duplicate classes of drugs. That is the only way that we can do that. So right now, you are really, as your own manager of your health, need to make sure that the doctors are updated and the pharmacists are updated on those lists of medications. And that is one thing the pharmacist has the special skills to do, is take in those drug lists and query you on all the things you may be taking. And they do what's called medication reconciliation, and meaning that they take all the ones that they see on your list, but then they ask you if you're taking other medications, and they can get your full list out there so all of your physicians in your health system know what's happening with your medications.
What are some common medication mistakes that kidney patients should watch out for? And how can a pharmacist help prevent them?
One of the major things I see patients do is, before they leave the doctor's office or the pharmacy, is not understanding why they need to take that medication. Why is it important to them? And some of these basic things like checking drug interactions and whether they have drug duplicates are very important. I see lots of times, because physicians are very busy, that they basically say, okay, I've given you a prescription, and then they leave the office and nothing more is said. And then unless the patient asks themselves, they don't get the answer. And then they get home and they think, why am I taking this medication? Well, I don't feel bad, so I don't think I really need to take it. And they either decide not to even go get it, or they take less of it, or if they have a side effect, they say, oh, I'm just not going to take it, instead of getting back and feeding back to the physician and or the pharmacist to let them know that they're having problems with it or they don't know how to take it. So never leave the pharmacy, never leave the physician's office without getting that information. And secondly, if you are having problems remembering all those things, I mean, I'm getting older, I forget things. So bring a care partner with you, a neighbor, a good friend, a trusted friend that can help you write down that information and help you ask those questions as well.
Again, thank you, Dr. St. Peter. Your participation in our patient meeting has been instrumental in advancing patient knowledge and fostering a collaborative approach to managing kidney disease.